Large autohaemotherapy. The most effective applications with ozone are the large autohaemotherapies as hyperbaric and normobaric therapies. A Sankey set and a hypodermic needle, in our case a butterfly needle 1.1 yellow, are used for both types of treatment, together with an anticoagulant. For 150 milliliters of blood, you use 10 milliliters of 3.13% sodium citrate from an ampule. Hang the Sankey set into the hook of the infusion stand and close the roller clamp of the lower hose. Connect the upper hose from the Sankey set to a protective filter and plug this into the vacuum connection of the Humares. Connect the butterfly needle to the hose with the roller clamp. Leave the protective tube over the needle at the moment. Use the vacuum button to generate a vacuum of approximately 300 millibar and, with the roller clamp open, suck the sodium citrate completely into the Sankey set via the protective tube. With this method, the hose with the roller clamp is wetted internally with the anticoagulant. If you use heparin or ligvamin as the anticoagulant, it is appropriate to pass this small volume via the upper injection valve into the Sankey set. Then close the roller clamp and generate a vacuum of 300 to 400 millibar for drawing blood. Now pressurize the vein of the upper arm, clean the injection position and inject. Then open the roller clamp and suck in about 150 milliliters of blood. Rotate the Sankey set gently in the process to mix the blood with the anticoagulant. Once about 150 milliliters of blood have been sucked in, loosen the vacuum connection and allow about 10 milliliters of blood with the anticoagulant to run back as an intravenous drip. The needle will then also remain free, and you can carry out gassing of the blood without hectic. An overpressure results in the Sankey set during the gassing of the blood, and therefore the roller clamp is now closed to avoid the possibility of gas embolism. Ozone gas is then extracted via the suction hose with the sterile filter. The Humares Promedic only outputs ozone when the ozone valve is pressed. It purges the hose within the Humares for about 3 seconds and then directs the ozone gas into the Sankey set. An overpressure then results in the Sankey set, which can reach 0.8 bar. At the same time, the display switches to dosing mode and indicates the amount of ozone dosed. Once the desired micrograms have been reached, stop pressing the filter into the valve, whereupon the ozone generator stops and retains a residual pressure in the Sankey set. Then rotate the Sankey set for about 1 minute. The blood will usually become bright red. You can set the intravenous drip speed on the infusion stand. The drip is finished after about 10 minutes and the treatment is complete.